also start the recording of today's session. And basically, with the recording, what we do is we distribute the recording afterwards as well. So
that's fine.
People who couldn't make the day today are able to join in afterwards. So Nick, thank you very much for joining us today on the Aged Care Experience Masterclass with Energesse. As most people are aware, you are the CEO of the Aged Care Quality Agency, and the topic
for another month.
For another month.
Correct.
Month. That's right. You're sort of leaving behind your legacy, I guess.
Let's hope so. Yes.
With this webinar. So thank you very much for joining us, particularly on today's webinar, which is all around improving the aged care experience, particularly in lieu of the new quality standards that you've worked very hard to develop over the last few years.
That's
so
right.
Nick, just in terms of, so thanks for joining us. I'm just looking at my notes right now and your bio, and I just wanted to read your bio very quickly, Nick, before we begin. You have a bachelor's in theology and a graduate diploma in education, as well as corporate governance and strategy with the AICD, and you're appointed as CEO of the Australian Aged Care Agency in April 2014. So over 4 years, you've been in the role, which is fantastic. You've had a lot of extensive experience in public administration, specializing in central agency functions, human services, stakeholder engagement, and previously you were a senior executive in the Queensland government from 1998 to 2010, as well as the CEO of the Leading Aged Care Services Australia for Queensland.
Correct.
Yeah, excellent. Well, it sounds like you've had this fantastic background, Nick, over the last few years. What has been some of the highlights for you in terms of your career to date?
Thank you, Sabi, and thanks for the chance to join, especially with people watching in from around Australia, perhaps more broadly. I think the things that have always interested me, I've always been interested in the notion of how do we make systems and organisations work better for their consumers and for their participants. And it's a bit unusual that I ended up as a regulator, because we tend to think of regulators as people who are perhaps stern and a heavy emphasis on authority and compliance and so forth. And one of the things that I've been grateful to do is to be able to design new approaches to systems that do look after safety and quality for vulnerable people, but are innovative in terms of the development of new products, new approaches, and more open cultures where people can have conversations around risk and safety, not so much from a punitive point of view, but in terms of providers and people who actually provide services managing their own risk in more conscious ways and in more skillful ways. I did have in 1998 the chance to design a new approach to take government and joined up government systems to be more available to people who lived in regional Queensland. So I'm an educator from way back. I still have a great interest in philosophy and so forth. And what really interests me is social policy and how do we make systems work better for people to build capacity and dignity for people. And so, as well as having been the aged care regulator for almost 5 years, I did work in other human services areas such as child protection, children's services, youth justice services, and so forth. And of course, much earlier than that as a teacher. So ideas and people and improvement inspire me. And certainly in aged care, which we know is in the middle of significant transition, a Royal Commission already underway. This is a really important time for the Australian community to think more deeply around what it means to become old, around dignity for older Australians, perhaps to challenge our myths around death and dying and care, and certainly to ensure that older people have the information and the choices about how to lead the life that they want to lead.
Yeah, it's really interesting, Nick, and I think this is where you and I had some commonality. Me coming from that medical background and then having worked in health systems and different health verticals across the years, and noticing that to make that bigger difference in society, to make that greater social impact and improvement of care and the experience, you have to understand how systems work, and you have to improve the quality, performance, and safety of systems in order to make that improvements in people's lives over a longer period, but also to affect a larger population as well. And it's really, really interesting, particularly as you mentioned, with the trend, with the the Royal Commission coming up, the new quality standards, and I suppose many members of the audience here would want to hear your perspective on how do you think, based on the needs of our older population, our aging population, and the health outcomes, and the way in which we live, and the way in which we pass on, how do you think we're performing in terms of that overall quality, safety, and client experience? How do you think we're doing today?
I think to just some background for you might be helpful. In residential aged care, there's about 75 million days of care in Australia every year. There's 1.3 million care recipients. About 1.1 million of those live in the community in their own homes. So we have, although we have challenges, and there's no doubt that there's a need to examine those challenges and to address those challenges squarely, we know that the vast majority of care provided in Australia not just meets the standards, and my organisation applies those standards with providers, but the vast majority exceed those standards in providing effective care. Of course, any instance of poor care, let alone abuse or assault, is absolutely unacceptable. It's a crime, and it should be treated as such. However, whilst we remain vigilant, we know that about 90% of providers at the moment meet the standards every time we assess that service. And we know that even those who aren't meeting the standards are squarely committed to addressing what they need to do to improve their performance. And unfortunately, in some instances, perhaps fortunately, there are pockets of providers who can't or won't be able to meet the standards, and they exit the industry, and we think that's important. But for the vast majority of those 200,000, 205,000 aged care in nursing home residents, they report, not just we find, but they report through our consumer experience reports, which is one of the reasons why you and I first met, is to share insights and thoughts around understanding consumer experiences better. And so we know that the vast majority of aged care consumers rate the quality of their care and services quite high to very high. There were two in our first year of reporting this data. The two areas that were lagging behind the others, and this might not come as a surprise, is around the quality of food and the dining experience and loneliness in aged care. So we know that whilst the vast majority of care is appropriate and meets the standards, and consumers and their representatives tell us that, as well as our own observation, we know that in the areas of food and the dining experience, as well as loneliness and perhaps depression, remain areas of particular concern and focus based on that statistics. And if the audience want to go to the Aged Care Quality Agency website and look for the link on consumer experience reports, you'll find a very early reporting from the last financial year. And we're working with Professor Yvonne Wells from La Trobe University to do more analysis on that. And we'll be happy to share that as that information comes to hand.
That's a great resource there, the consumer experience reports, and on the Aged Care Quality website. And in terms of Nick, in terms of the new accreditation standards that are coming through to be effective in 2019, obviously many people in the audience in the aged care sector will want to know what are the new elements that are part of this aged care standards, and particularly what's different. What are they going to expect to be different moving forward?
Well, there's a short answer and a long answer to that, but the short answer and the most important component is it's all about consumers. So the standards that we currently have, and they're almost 20 years old, so they've been a long time. They've been up for review for the last few years, and we're about to transition. But the old set of standards were effectively a conversation between a regulator, a government regulator, and an aged care provider. Of course, they were about consumer choice. Sorry, they're about consumer care, but it was never imagined that consumers were active partners and drivers of their own lived experience. They were recipients. They were called aged care recipients. And whilst it was never framed quite like this, it kind of portrayed consumers passively. They were recipients of what other people did to them in a nursing home environment. Now, of course, I say those words out loud now, and of course it grates that somehow someone for whom a care system is designed, it's almost like talking about you, not to you. And so the new standards place consumers front and centre. All of those standards start with a consumer outcome, a consumer statement. And if I start with the first one, consumer and dignity choice, the consumer dignity and choice, the consumer outcome, long before we're talking about providers, is I am treated with dignity and respect and can maintain my identity. I can make informed choices about my care and services and live the life I choose. Now, long before we get to what the organisation has to do or basic requirements to meet that standards, it frames the consumer front and centre. It's in the consumer voice. It's what I seek to do. And aged care is no different to lots of other industries. If we were running hotels, for example, if we were into hospitality, and we thought that running a good hotel was just about getting the bedding right or making sure that the bathroom was clean, as though it was all about our activity, and somehow the visitor or the guest was somewhere in a different space, we would run out of business. Consumers would run. Businesses that thrive have a passionate interest in the experience of their customer, a passionate lived experience, lived passion and commitment to the experience of their customer. And aged care should be no different. And so instead of saying, as we currently measure under the standards, do you provide your consumers or your residents with choice or appropriate food, for example? Under the new standards, they need to show how they ask the residents what they want, that they take on board resident expectations, that they customise and tailor their care around the consumer experience, that consumer evaluation and feedback drives continuous improvement. It puts the consumer in the centre, not the provider in the centre. And these reforms are part of a broad raft of Australian government reforms about stronger consumer information, stronger consumer choice, so that it is a highly disruptive process, we understand, for the industry, but it's what older Australians seek. And it's in fact this level of choice and autonomy and control over my life that I seek at the age of 55, and that you would seek. I think you're a bit younger than me, Harvey. But
I've got a bit of time. Yeah, I've got a bit of time.
That's right. We would seek that same capacity to choose about our life into my 80s and 90s that I expect in my 50s. That's what aged care reform's about.
And so some of this, I guess, in principle, there's going to be this very significant greater focus on listening to consumers, collecting that feedback, using that feedback in a more timely way to create continuous improvement, and showing tangible changes in areas that matter most to those consumers, right?
Correct. And what we do already as part of our practice, we interview between 10 and 15% of the resident mix of every home. And in the vast majority of those cases, we now publish the answers to 10 standardized questions. But really, if I could summarize the difference between current accreditation and where accreditation will go in aged care post-July next year, is that historically we've gone into a nursing home or to a home care provider and said, tell us whether you're providing good care. And homes would produce lots of policies and practices, clinical charts, data and information. Really, the real difference between the system as it's been up until now and where we're going next year is the single best answer an aged care provider can give to the quality agency when it comes in next year is when we ask, what's the quality of care like in your home? Providers should say, go and ask any of my residents. They'll tell you what it's like. Now, that's not to say that we don't want to hear from the provider and the provider doesn't need documentation and good systems and good procedures and so forth. But that's the punchline now. Ask any of my consumers and their representatives, because they're the ones who will decide the quality of care. They're the ones best able to judge. They're the expert in the quality of aged care because they're an expert in what is high quality for their own life.
And so it's really about tailoring the quality to a degree to what those consumers or specific residents within that service have been wanting, asking, as well as the blend of providing the existing documentation that organizations have been providing in the past as well.
Yes. So in the past, we've looked at the quality of care and services, which we'll continue to do, but increasingly now we want to see how the quality of care and services directly translates into a higher quality of life for the consumer. That's the real linchpin. It's also important to note a few other things about the new standards is we currently have 4 sets of standards in Australian aged care. We have residential aged care standards, we have home care common standards, we have transition care standards and Aboriginal and Torres Strait Islander flexible care standards. So these new standards, which have recently been brought into law following their passage through the Parliament and them receiving royal assent, is that they'll replace all 4 standards, and all Commonwealth subsidised or Commonwealth funded aged care needs to comply with these new standards, which have 8 standards, and they include consumer dignity and choice, ongoing assessment and planning with consumers, personal care and clinical care, services and supports for daily living, organisations, service environment, feedback and complaints, human resources, and crucially, organisational governance. So we will measure all aged care providers proportionate to the services that they provide. So if they're a home care provider basically providing, for example, domestic support, cleaning and so forth, or personal care, helping an older person with showering and so forth, we're obviously, but they're not applying medication, they're not administering any drugs, we obviously won't be measuring them against requirements that they don't need to provide. So it's a proportionate, scalable approach to accreditation based around the consumer experience, consumer choice, consumer voice, and we will look for them to be able to point to how they keep consumers front and centre and how consumers play the most active role that is appropriate for that consumer, that is possible for the consumer in terms of making sure that services improve their quality of life.
Yeah, that's fantastic, Nick. And obviously you mentioned that, you're going from the 4 standards to the 8 standards, and I've looked at the standards closely. They are on the quality agency website as well as the Department of Health website. Right. What are the other elements of those 8 standards do you think are particularly new or different compared to the 4 standards we have previously? What are the ones that perhaps some people may call them, perhaps a bit more onerous or a bit more, I wouldn't say the word is surprising, but probably, in terms of the requirements, probably quite different to the consumer aspects that you just talked about?
So other than consumer, the stronger consumer voice and so forth, it's really corporate governance. So So under the law, under the Aged Care Act, it's the provider who is responsible for a great many things. And in the past, historically, we've had a very strong focus on clinical governance, and we'll never lessen that. But increasingly, we want providers at the governance level. That's the senior executive, or it's the and it's certainly the board, where there is a board who are responsible for care and so forth. We look for strong corporate governance. One of the things that we find with aged care providers, especially where there is serious non-compliance, is that you've got people on the floor delivering care, but there's a big disconnect between frontline staff and those that make the ultimate decisions for the organisation.
Yeah.
So stronger corporate governance, and that's in Standard 8, organisational governance, requires that board members are board members, or those that make ultimate decisions around safety, risk, identity, strategy going forth. They need to be able to evidence that they're all over the business, not just sitting in a boardroom, signing through papers. They need to show a passionate and direct involvement in the service delivery of that home, and we will increasingly be holding those responsible for corporate governance responsible, not just a nurse who's on the floor.
That's a really interesting one, Nick. When we do work with a lot of the organizations that we work with who want to improve experiences, one of the recommendations we say is that senior exec should be spending what we call customer days, and that is days in the front line where they shadow the front line for either half a day to a day, perhaps once a quarter or once every few months, so they really get that frontline interaction and truly understand their business from that level. What do you think is the kind of evidence that organizations will need to do in aged care post July 1 to demonstrate that strong leadership and corporate governance? What are the pieces of evidence you think they'll need to show?
I would encourage your audience to go onto our website and to look at the requirements around all of the 8 standards. So around corporate governance, and I might read from some of our material, it says the organisation demonstrates the following: consumers are engaged in the development, delivery and evaluation of care and services and are supported in that engagement. The organisation's governing body promotes a culture of safe, inclusive and quality care and services, and is accountable for their delivery. Not their staff. Of course their staff are accountable, but the notion that says, well, look, we delegated that. We delegated that. And we found that in lots of service environments. We know that in work health and safety legislation now, people at the board, the chair of the board can delegate lots of responsibilities, but never work health and safety responsibilities. Every member of the board in work health safety carries a personal liability, not just a professional liability for occupational health and safety. Whilst these standards don't go as far down that path, I would encourage people to look at that and to mirror that type of passionate involvement and personal accountability and broader responsibility. One of the good things I hear, and this might sound unusual to you, is from time to time I meet providers who advise me that they're leaving the industry. They say, I'm not set up now. I'm not set up. I don't think I'm ready to go the extra mile that the new requirements and the new culture will require. I prefer to pass it on to someone else who has that right passion, sufficient passion and commitment to go the extra mile. So it's a bit equivalent to, sometimes you hear that people break off their engagement, and whilst it's sad, it's probably good, because if it was not going to work, then better that we name that now. So, so there are lots of responsibilities. One of the things that I can always tell if I visit a nursing home and I'm being shown around the nursing home by the CEO and or a board member is, does that person know the codes to get through the locked up areas of the home, for example? So do they know residents by name? Even better, Do the residents know them by name?
Mm.
And where there is a personal involvement, where there is a strong personal connection between the decision maker and the people who receive care, it's a very good proxy for the overall performance of the home generally. And so
Interesting.
you can't manufacture familiarity. It's a bit like you can't learn all your French the night before the exam. You just can't do it.
I've tried, but that doesn't work.
That's right. That's right. I'll just grab some water. I'll just top up my glass.
Yeah, that's really interesting, Nick. I mean, clearly what you're saying there is that the culture is and how the leaders engage within the organization, the familiarity, their ability to connect and resonate with the residents, the people that they care for, as well as staff, clearly shows whether, what you're seeing anecdotally is a link with the overall performance of that facility. It's very, very interesting. And I encourage at this point, if any audience members, we've only just got a couple of questions left from me. So if any audience members have questions, to feel free to post them in the chat box on the bottom right. There's a little chat word there that you can click on, and that should be able to allow you to ask some questions. We might have time for one or two at the end. It's really interesting, Nick. How do you see, on the converse side, we talk a lot about the providers, and you've talked about the area for improvement of focus, particularly around involving consumers in choice, in the dignity of their care, provision of information, talked about food and dining and corporate governance. How do you see their expectations evolving over the next 3 years? So whether they're in a home care setting or their family expectation, we haven't talked much about family members yet, but also the resident expectations. How do you see that their expectations changing over the next 3 to 5 years as well?
I think they'll be different depending on whether it's residential care or home care. In residential care, people are going into residential care older and with greater frailty, greater acuity, and sadly with higher rates of dementia. Now we know that all nursing home residents that in a nursing home, somewhere between 50 and 70%, because it depends on the diagnosis and the diagnostic threshold there, have some cognitive decline, normally due to dementia, Alzheimer's, vascular dementia, and so forth. So for those people, their expectation would be around still greater choice and dignity and support, but clearly support that emphasise the safety and well-being of the resident. In home care, where there's over 1 million people receiving some form of Commonwealth subsidised home care, it's really about choice. It's really about choice. And a major policy reform in aged care from a few years back is consumer-directed care. So in the old days, if you underwent an assessment and you were found eligible for a package, you would have to hunt around to find a provider that had a spare package at your level of need. So the focus again was on the provider, and the provider would look after the consumer. So that policy reform was all about giving them the money, the choice, the power to the consumer, and they can pick and choose which providers they seek for what kind of services lead to a better quality of life for them. So we know it's important that they have good information to inform choice around care. And that's why the consumer experience reports in residential care, and we'll start doing those in home care next year, help consumers understand what other consumers and their representatives have to say. So it's really about choice. And that's really practical things like, what type of care will I receive? Is it domestic care? Is it community transport? Is it someone to come and keep me company? Is it someone to come and give me the injections I need? So it might be clinical care. And so it's really up to what type of care do I want? How do I want it? When do I want it delivered? Can I save up my care hours and my care dollars because I know I'm having a hip replacement, and therefore I will need much more care going forward as I recuperate from that surgery. So it's that greater flexibility, again, so that the person can say not so much in the first instance, what kind of care do I want? It's what's the best quality of life that I can lead? And what are the things that are most important for me? What are the things that will give me greatest satisfaction, greatest dignity, and so forth, and well-being? And therefore, how do we tailor a package of care around a person to lead to that higher quality of life? That's what consumers want in home care. We know that the vast majority of consumers will only ever want home care. They would not seek to enter into residential care, but residential care remains the choice for around 200,000 Australians because they're unable to receive appropriate care given their needs in their home environment. I think you've gone to mute, Avi.
Okay, I think I'm back now.
You're back, I think. Good.
Okay, great. And I was just saying that, it's a really nice structure that you've provided there, which is, really engaging with your consumers or residents in terms of asking them what is the quality of life that they want, what is important to them within that for in terms of facilities or services that matter the most to them. And then as a provider, asking yourself, well, now how do we tailor our services, either adapt our service or create new services that fit in or that package up with the needs and requirements of consumers. And we find that that's a constantly evolving space, isn't it, Nick? As the thought processes of consumers change over time, expectations can change, and then obviously there's the input of the family members as well into shaping that, I suppose, perspective of what matters most to their mother, father, or resident that they care for as well.
I think there could be a challenge, a rising challenge in aged care going forward, and part of that's generational.
Yes.
One of the tensions we encounter in aged care regularly, and aged care providers would know this infinitely better than me, is balancing the hopes and expectations of children over and against residents. So one of the difficult areas for providers is to ensure that it's the consumer choice that comes first, the resident choice that comes first, and to have to balance that with what can be conflicting expectations from perhaps a son or a daughter passionately interested in care. Now, this question about what is best for mum is as old as time. So it's not that's not something that we're encountering now. I think all good literature includes this type of stuff. But one of the areas that we're particularly focused on is increasingly it's about the consumer choice. And we need to be respectful and very, very much aware of the crucial role that family members play, certainly as carers in a home care environment, and as supporters and visitors and family members in a residential environment. But increasingly, we will look for providers to be respectful of what family members want and responsive to what family members want, but to prioritise the needs and the wishes of the consumer first. And that includes where there's a diagnosis of dementia. Unless there's legal substitute decision maker, a diagnosis of dementia does not mean that a resident should no longer be consulted, no longer has a point of view, or no longer has agency. So unless it's in the very final stages of dementia, where there is not a capacity to make a decision, having that diagnosis does not exclude me from decisions about my life and my choice. And in fact, we interview for our consumer experience reports, and we do about 50,000 overall experiences this year. We interview lots of residents with dementia. In fact, we have a visual analogue for them to indicate their choices even if they no longer have active verbal skills. So I think those areas about assumptions that we can make around dementia and agency, and how does a home focus on what the resident wants, and how do they balance the tension that can go with what family members might want.
Yeah, that's really interesting, Nick, especially in how you're, you've still gone ahead with questioning and engaging the residents with dementia as well. And it's important to understand the degree of dementia before you even think of excluding them, in involving them in that conversation. I think that's fantastic. We're starting to get questions from the audience. I'll read out a couple in a second, but as we're approaching the end of this webinar, what are the tools or resources or data that you suggest aged care leaders consider utilizing to drive improvements in the future? So I know there's a lot of resources on the website for the Aged Care Quality Agency as well as Department of Health, but are there any other specific tools, resources, or data sources that you would recommend audience members in the industry seek out?
Well, I would encourage your audience to have a look at our website, not just for our guidance materials, but for our education sessions, including webinars. And so there are lots and lots of resources. And in fact, if you go through the guidance material, there are lots of references to broader information around the aged care sector, and in clinical guidance and so forth going forward. I would certainly look very carefully at the new standards. I would begin to test out immediately, if I was a provider, how especially can we evidence the role of consumers in meeting the standards, the new standards. One of the things is that a lot of what satisfies us around meeting the standards will continue to satisfy us. There's no doubt about that. So it's not that everything changes, but this is, if people think that the consumer voice is a virus that aged care will shake off in time, right? This reform, we've gone through reforms and that's okay, we'll get back to business as usual. The consumer voice is not a virus in the body. It will genetically re-engineer aged care. This is, and of course, when we begin to compare provider-centric care versus consumer-centric care, when we begin to say it out loud, it just sounds silly that we could have ever thought in such a provider-centric way. And of course, perhaps we do things in our practice today that 10 years from now, there's the wisdom of hindsight. I would particularly look at corporate governance material. There is some information, and I can send you a link that you can place on your website and so forth, or you could forward on to your participants.
Absolutely.
We had done around corporate governance in aged care based on an AICD model, and we developed that with a group of 10 homes in Adelaide a few years ago. But I would look at the guidance material. I would look at the industry education offerings. Some of them are face-to-face delivery, some of them are group delivery, and some of them are webinars. And I would, if they're members of aged care associations, I know that the 3 large peak organisations are providing training opportunities, and I would encourage people to look for all the opportunities that they can look for. But there is a mine of information on our website and on the Department of Health's website in aged care, and that's the first port of call.
Fantastic. Thanks very much, Nick. Couple of questions from the audience now very quickly. So one of them comes from Rob McMillan from Devon, and his question was around the need for safety, quality, and risk executives. And so the question was around, as we move into these new standards, do you foresee a need for more safety, quality, and risk executives to come into the aged care sector? And where do you think that talent may come from, seeing as how there are staff shortages being noted in the sector already?
Of course.
So do you have a perspective on that?
Yes, I think no two providers are the same, but given the importance of quality, safety and risk, and especially around Standard A corporate governance, if I was on a board, I would be asking the CEO of the organisation, how are you prioritising quality, safety and risk in order for me to be assured of that? So yes, I could see easily the rise of not just clinical governance, but quality, safety and risk more broadly across the home.
Yeah. And do you think in terms of, do you think that we can train people up more within the industry to become qualified in that space? Or do you think we're going to need to bring in executives perhaps from healthcare or hospitals or so on to infiltrate the aged care sector more moving forward? What's your thinking on that?
I'm all for having, if you like, porous boundaries between different sectors. I think we always have we always have a lot to learn from other sectors about how they do things. I think we have a lot to learn from disability around consumer choice and consumer voice. In fact, I would think that a lot of the consumer voice and choice policy reforms that in disability sector, they're perhaps a generation in front of us in that space. I certainly think clinical governance models out of acute care hospitals and so forth always have a role to play. And I would think it's not just quality, safety and risk, is who's the chief customer officer? I've never heard of chief customer officer, but you know, how do we know that? And it's not just running surveys. It's how do we build the culture of an organisation that makes that happen in a more cogent, predictable, continuously improving way. And of course, this is one of the reasons why when you reached out to me, I was happy to meet with you, because an organisation that focuses on consumer experience and patient experience, if you can't get that part right, you're not going to survive in aged care going forward.
That's a great note to sort of end on, I suppose. But there is one last question, if you're happy to take it. It's a question around advanced care planning, and the question was from Judy Blakely, who had actually two questions. One was around advanced care planning. Are there initiatives in Queensland, or if they are in other states, how do you find out about them? And then the second question was around, I'll just look that up again. You know, how about having health consumers on the boards? You know, is that something you would encourage or recommend as well?
Well, thank you for the question. I think the question about advanced care planning, if your questioner is asking, you mean, is there a greater role for people defining in advance what type of clinical intervention they do or don't want? Was that the nature of the question?
It's hard to say at the moment. The question was more, do you have advanced care planning initiatives in Queensland? So it was specific to Queensland.
There are certainly under the law in Queensland, people can establish advanced care plans. They're legally binding. If they're properly established, they're legally binding on all healthcare providers, including aged care providers. Advanced care planning, advanced care directives, they're sometimes called, have to be taken on board by a clinician in the provision or in the withdrawal of care. I would encourage your audience member to ring the 13QGov, the Queensland Government Call Centre. I'm a Queenslander, by the way, even though I'm in Parramatta. So I would ring the Queensland Government Call Centre and ask for broader information that would either come from the Attorney General's Department or from the Department of Health in Queensland.
Fantastic. And just the second one was just about having health consumers on the board. Is that something that you recommend or encourage as well as part of this governance?
Yes. yes. I think it's a useful role to play. I would encourage any board to think carefully around it being more than tokenism. So it's useful to have a consumer representative on the board, but you would need more than that to thrive in the new environment. And it's possible that you wouldn't have a consumer on the board and still meet the requirements under standard or outcome 8, standard 8, I'm sorry, going on next year. So, so yes, it's certainly an option, but you would need to think more carefully than that. And we've all seen governance boards having a rep for this or that, and at times it can be a bit token. And I've sat on boards that have had reps, and they're, you know, I tend to recruit, if I'm looking at a board, I recruit rather than based on franchise, based on skill and capability in corporate governance, and to always look for that mix where that's possible. Yeah, fantastic. Nick, thank you very much for that. You know, I think we want to respect your time, really appreciate having you, you know, provide all this information around to help aged care facilities and providers, as well as particularly on the consumer side, understand better what some of those perspectives are and how to actually better set themselves up in light of the accreditation standards in the new year, as well as the Royal Commission. Just a little bit about Energesse. Again, we often share just a little bit about what we're doing. As you mentioned earlier, Nick, you know, our shared passion and our mission is really to improve care experiences across the health and aged care sectors, as well as disability. We've worked across many different verticals of these sectors. I won't go into detail of all the organizations we've worked with, but over the last 6 years, that's really been our specialty area. As you've rightly pointed out, it's not just about surveys. So we do help with surveys, but we'll also help organizations do analysis around their reporting, looking at their leadership and frontline engagement, customer service training, implementation skills, program evaluations, and also we're starting to develop more and more that sense of community across providers that want to share best practices as well. So I'd encourage anyone who's listening today who wants further detail to obviously look at the resources that Nick has mentioned, but also if you do require further support, very happy to have a conversation. Particularly one of the new things that we're launching is this Health and Care Experience Network, which is all about that person-centered care. How do you bring about experience improvement as well as that performance and change leadership? So at the moment, we just want to let everyone know this is a network that's fairly new. We'd like to encourage you to apply for a trial of that program. Here are some of my details as well as Sharon's details, and you can see a lot of the Energesse team here. But very much just to conclude, I just want to thank you, Nick, again for your input, for your contribution to today, particularly with just a few weeks left to go in your role. Your great insights into the sector and what it needs to do has been fantastic, and I'm sure that everyone's really, really appreciative of your time. So thanks very much, Nick. Thank you. Can I just? Yes, absolutely. Can I just, as a closing comment, just to emphasise that the legislation's gone through Parliament for the Quality Agency and the Complaints Commissioner roles to cease at the end of the month, and a new Aged Care Quality and Safety Commission, led by the Commissioner Designate Janet Anderson, will come into existence on the 1st of January. So that's the first major transition of the Complaints Commission and the Quality Agency staff coming together, and staff from compliance and prudential and approved provider processes are scheduled to come over on 1st of January 2020. I wish all of your audience well, and thank you for the invitation. It's good to talk to you, Avi. Thank you. Thank you very much, Nick, and thanks everyone for listening in today, and I hope you have got a lot out of this webinar today, and feel free to connect with us also on the various social media channels that we've listed on the below. Thanks very much, Nick. All the best to you, all the best to everyone, and look forward to staying in touch moving forward. Thank you very much. That's great. Bye-bye now. Okay, bye.